What is an individual funding request? A vast number of treatments and services are offered routinely by the NHS. As medical technology advances, new treatments become available and decisions have to be made whether they are introduced into the NHS. Sometimes treatments are not made available as there is limited evidence for how well they work, or because they're very expensive and don't offer good value for money for taxpayers and the NHS. Sometimes the treatment might be very new and there hasn't yet been time to assess whether it should be introduced. Very occasionally, it may be fair to fund a treatment that isn't routinely offered by the NHS for an individual patient. This is called an individual funding request, or IFR. An individual funding request can be made when your clinician believes that your clinical circumstances are clearly different to other patients with the same condition, and when there is a reason why you would benefit clinically from the treatment in a different way to other patients. This is known as clinical exceptionality. For example, a patient had an unusual complication of rheumatoid arthritis, which had resulted in the collapse of both of his lungs. He was finding it difficult to recover from an operation to re-inflate his lungs. His doctor knew this was because of the treatments he was taking for rheumatoid arthritis. The patient's doctor requested a treatment not usually used for arthritis, but which could control his condition whilst not impairing his recovery as much as the usual medication. This is considered extremely carefully before a decision is taken to fund a treatment for an individual that wouldn't usually be available to other people on the NHS. Individual funding requests are made by a clinician. Your application will go through a screening process to make sure certain criteria are met. It will then be considered by an independent panel made up of doctors, nurses, public health experts, pharmacists, NHS England representatives and lay members. NHS England will let your clinician know the outcome of the funding request, and you will also be sent a letter to notify you of the decision. Your clinician will then meet with you to discuss the decision and your treatment. Applying for an individual funding request is often an anxious time for patients. Usually, a decision is made within 30 days, but it can be faster for urgent cases. More about individual funding requests is available at www.england.nhs.uk/IFR.